Hey, what's going on, everyone? Dr. Taylor, Aspire Chiropractic. Today I want to talk to you about decompression. What is it? What is it used for? Why do we do it? Hell, why are we the best at it? So, decompression, it's exactly what it sounds like. A lot of times someone will come in here 30 plus, give or take, 30 plus years of age, and they'll have certain complaints, certain issues, certain things they want to get checked out, certain things they want to make feel better. That decompression will absolutely help them with. Hell, I talked to a guy just this last weekend. I got into a car accident. Can I be adjusted? Absolutely. But I got this running pain down my arm and my leg. What else do you think I should do? Sounds like you should do decompression. So why do we use decompression? Let's go over a little anatomy here, okay? We're going to look at a bone or a joint complex of the spine. So this is a vertebra. There we go. This is the front. This is the back side. So you're looking that way, right? Way up here is going to be your face. And we go here. Here's another bone, just like that. We go down like this. Body of the vertebra. And then we've got these parts back here. Now, we've got a few very important things going on here. Number one is going to be this disc. Every bone in your spine, save for your very top cervical bone, is going to have a disc between it, okay? And what that does, that provides cushion, provides motion and movement. It also provides space in this hole here. Now, the head is going to be way up here. Brain is also going to be up there because that's where it is. It's in your head. But coming out of your brain is your spinal cord. And it runs down the back side. I'm going to take this down a little bit. Runs down the back side of these vertebrae. And then coming out, I'm going to replace that disc. Coming out of this hole created by these two bones is a nerve. Now, every nerve in your body, except for maybe just a select few at the very top of the spine, but every other nerve in your body is going to originate in your spine. So, decompression fits into this in a couple different scenarios. Number one, if we've got a bulging or a herniated disc. A herniated disc is a disc that has moved beyond its normal space. So, it could be pinching back here on the spinal cord itself, or it could be pinching from the side on these nerves that come out. So why do we get a bulge or herniation? It could be from any number of things, bending, stooping, lifting heavy weights, but really, regardless, what happens if we're going to look at the disc here, what I want to do, we're going to turn you on end. We're going to look at it from the top. It's got this fibrous outer ring, right? So this here, it's got a bunch of different layers of tough connective tissue. Then on the inside, there's a jelly. So what happens, this thing gets squeezed, that jelly kind of leaks in to these layers here, and it causes that thing to bulge out. In the case of a herniation, that jelly goes from the inside to the outside and presses back here on those nerves. The other thing we can have going on is we can have an old spine. We can have degeneration of these discs. We can have arthritis starting to form. What happens is the body starts to lay down more bone. We'll get these bone spurs here, and you might hear a word called stenosis. If you go to your GP or maybe a PT or even here, and we recommend an MRI, we'll go get an MRI, and all of a sudden we'll look at these nerve holes, and they're smaller than they should be because your body has started to lay down more bone. We'll look at this disc space here, and all of a sudden this is thinner than it should be. You've lost disc height. And what that's going to do, same thing. It's all about putting pressure on these nerves. So from a decompression standpoint, what do we got to do? It's super simple. We've got to make this hole bigger. Stenosis is just a fancy Latin word for a hole gets smaller. So decompression, what do? We stretch you vertically. Because from a chiropractic standpoint, what do? I move bones forward, backward, left, and right. It's kind of hard for me to move them up and down. So by stretching this thing vertically, we increase what's called the lateral recess or the lateral foramen, aka we unpinch the nerve from the side. Also, when we increase the length of the spine, when we pull it like this, that creates a negative pressure, which if we've got a bulge or a herniation, will start to suck that disc material back in where it belongs. So it'll take that disc off of those nerves. It'll take that disc off of the spinal cord. That's where decompression comes into play. With that being said, if you're coming in here and you're in some sort of a critical condition, some sort of an acute condition, decompression can be uncomfortable. Reason being is the muscles. So now we're going to look at you again. We're looking at you from behind. There's the base of your skull. Here's your spine. We're going to look at this in the realm of cervical decompression, because if it's going to be uncomfortable, it's going to be uncomfortable in the neck more often than not. Here's your shoulder level. C1, C2, 3, 4, 5, 6, 7 right there. Man, that worked out perfect. We're going to draw your shoulder blades in here. So if we're doing cervical decompression, if we're stretching the neck to either A, eliminate causes, signs, and symptoms of that degenerative arthritis, or B, to help relieve stress caused by a bulging or herniated disc in the neck from like a car accident or something, we're going to do decompression. But what do we got back here? We've got a whole bunch of muscles. We've got your paraspinal muscles, which run up and down the long sides of your neck, all the way down, all the way into your tailbone. We've also got your traps, these big things here that run from your shoulder blades up to the base of your skull. We've also got another one, and this one's really a no pun intended, a pain in the neck. We've got this thing called your levator, and it goes from the top corner of your shoulder blade right to the base of your skull. So they all connect right back in through here. So when we're doing decompression to alleviate the stress on that disc, to alleviate the stress on the nerves, what are we doing? We're stretching this cervical spine vertically. Now, if you're coming in here from a car accident or from, a life of being at a computer, behind the wheel, more often than not on your phone, these muscles get tight, they get short. We get people that are walking in here with their shoulders tucked behind their ears. These muscles are used to being a certain length, right? And they're used to being tied up and tight. So as we start to gently stretch this, we're changing what the body is used to, okay? We're changing what it does most often. Now, when people come in here and they've got neck pain, they've got degeneration stuff going on here, they might be experiencing numbness and tingling going on. They're also going to have a whole bunch of trigger points back through here and a whole bunch of tight and stiff muscles. So what do we do to help eliminate or alleviate that? One, obviously we adjust the bones of the neck so we can take the stress off of that spine. But then with the decompression, when we start to elongate this, we're stretching those muscles apart. And that's not something they're exactly used to. We're not pulling them apart. It sounds worse than it is. But we're definitely causing a stretch that the body is not necessarily inclined to deal with. So then what do we hear when they come back? How are you doing today? My numbness and tingling might be gone. My headache might be gone, but my muscles are sore. It's not a traumatic soreness. It's not an acute soreness. It's a post-workout kind of soreness, more along those lines. The reason being, we've stretched those things more than they're used to. So the bad news is, this is kind of common. This happens somewhat routinely, especially if these muscles in the neck are super tight, the neck and the upper back. The good news, this stuff goes away. Because whether it's chiropractic, whether it's weightlifting or dieting, or heck, learning something new, literally all I'm doing, I'm teaching the body new things, okay? And if you want to change the body and you want to teach the body something new, it just takes two things. It takes time and repetition. So if you've got 20, 30, 40 years of being stuck like this, or you've got a traumatic event like a car accident or just a really nasty trip and fall that caused those muscles to spasm up, we need to teach them something different than what they're used to when they come in here. So we come in, we do decompression, we absolutely affect the disc materials and the joints in the spine in and of itself. But we also have an effect on the muscles that it's attached to. Muscles are dumb. They get stuck in their habits super easy. And if their habit is being short, we're trying to teach them something new. And that something new is to elongate them. And that process at the beginning, it can be kind of uncomfortable. But the good news is that will go away as your body learns to stay in the position that I put it in. So if this sounds common, or if this sounds like it's unique to you or somebody you know, if this is something you want to get looked at, by all means, give us a call, walk right through the door. We'll help you anytime you come in here. We'll do it with a thorough exam. We'll take some x-rays to actually assess the disc space between her, assess the bones we got going on, and then we'll figure out the best way to help you, which might involve decompression. And just a little forewarning, might be a little uncomfortable at the beginning, but this is definitely a situation where the ends justify the means. But regardless, we're ready to help you when you're ready to be your best. Naturally, right here at Aspire Chiropractic.